Hi everyone, just wanted to talk today about medication, changes to medication and withdrawal when you're trying to recover from anxiety because it's a big factor that can be overlooked. So, as a reminder, I'm not a doctor, so I can't give you specific advice around what you should or shouldn't be doing with medication. This is just what I've observed with the work I do with clients, my own experience. So do see your own professional to get support to make changes if that's what you decide to do or if you are deciding to make changes. But now that I've got that out of the way, the first thing I recommend, just to be clear, is that you can practice all the methods I prescribe or talk about, I shouldn't say prescribe, talk about or recommend here, whatever you're currently taking, whatever you're taking from a medication perspective, the method will absolutely help you wherever you're at right now. So that's the first thing. No matter what you're taking, no matter for how long, what dose, what combination, it doesn't matter. The method will help you start to practice with the symptoms, thoughts that come up in your current situation. So that's the first thing. We don't want to dismiss that because some people sort of think, well, can I practice? Can I recover? Absolutely. You can get on the road to recovery by practicing now where you're at. In fact, that's really important in order to establish good practices and habits. I would say perhaps even before you start to make changes to medication. We just want to, tackle one variable at a time. I would personally recommend. If you try and change everything, it's like, well, is this working? Is that working? This is affecting me, whatever it might be. And you're just not sure. You can be all at sea with it. So it can be quite confronting. So one variable at a time is just what I would say is good practice for life. Let's not try and change everything at once. If we change our job, relationship, we know it's hard. If we try and move house at the same time, it's very difficult. So even when we're thinking about our nervous system and changes to that, then think about maybe one change at a time. So the first thing you can do, no matter what you're doing from a medication perspective, is start to practice. Look at the anxiety cure series I've got, practice the methods I recommend and see how you go. Now, the other factor is that medication can obviously affect your nervous system because it can dampen it down, it can sedate it, it tries to have an influence on brain chemistry, things like that. The nervous system is all connected. So it is going to have an impact. So I encourage clients just to think about where they're at. If you're taking a whole lot of combination of medication, what effect is that having? What are the interactions? Do you know? If you practice where you're at right now as a starting point, at some point you might want to think about, well, is there any agitation? Are some of the medications causing extra agitation on my system that's making it harder to practice? Have I withdrawn too quickly from medication? The gradual effect is what is being recommended a lot these days from different psychiatrists. So are we stopping too quickly? And the body's going into withdrawal. And so there's extra agitation on the nervous system in addition to the normal sensitization that I talk about, which is making it even harder to practice. So some of my clients, they actually stabilize their medication and then over time start to withdraw very gradually, particularly the longer they've been on it. Now, if there's so many different combinations of medication, you're taking stuff in the morning, during the day, at night, is that changing your mood? Is that agitating the nervous system, dampening it down throughout the day? And is there withdrawal effects through the day? Is that sort of playing havoc with how you're feeling, which makes practice harder as well? So I encourage you to think about how you can try and stabilize what you're currently doing. Find a psychiatrist, a doctor who can really support you to do that. And maybe I would say for me, think about how you potentially get off the medication at some point, if that's what you decide to do, but there is no rush. You don't want to rush into anything like that, especially if you're not having good support along the way. A lot of my clients find they've withdrawn too quickly. So find a practitioner who can support you where you're at with it. Because if you're withdrawing too quickly, it's like, if you think about the metaphor of alcohol, you're drinking a lot, you're drinking every day, suddenly you stop, the body's going to go into withdrawal and it's going to make all the allowing, accepting just that much harder. If we try and practice with a hangover, that's really hard because our mood is already dampened down. The body's in withdrawal from the alcohol. There's a lot more agitation on the nervous system. So we want to factor that in and be really clear about it. So we want to think about that, the medication you're on, is there too many variables going on that you can't possibly, think about, well, which drug's doing what at what time? If it's too complicated, the more variables in there, it's going to be potentially harder for you to get a handle on it. Well, is the medication in the morning, during the day, at night? How many medications am I on? 3, 4, 5? Does the psychiatrist or doctor you're working with really know all the interactions? Is there a way to simplify it so you can just try and keep it simple, reduce the variables, but also if you do decide to do that, doing it super, super slowly so your body and your system gets a chance to adjust. And you can use the methods to practice along the way with any small changes you do decide to make at some point. So if you do start to withdraw or taper off, a gentle taper, I often call it, you can practice at every step of the way with these small gradual changes. And that's where the method can be really powerful. If we don't talk about medication that you're on and the agitation it can have on your nervous system, then we're missing a part of the picture for some people. Now, again, some people might be completely fine on what they're taking and you might be happy with that. Keep practicing and that's great. You don't have to make any changes you don't want to do. This is your life, your body. But it's just good to acknowledge the extra agitation, particularly withdrawal, can have on the nervous system. And making too many changes too quickly can be hard. But if you do decide to make changes, I recommend doing it gradually, step by step. And that's where the method comes into its own to really help you with all those stages of change. I hope that makes sense. If you've got any questions, let me know. And again, do find a good practitioner. If you're not happy with your current doctor, psychiatrist, find someone else. There's great doctors out there. There's also doctors that perhaps don't fully understand sensitization. So there might be a bit of a gap in their understanding. But if you've got any questions, let me know. And I hope to see you again soon. Take care.